Hello students, in this video we will discuss about the mechanism of breathing. Mechanism of breathing. Now what is the mechanism of breathing? First, inspiration. Inspiration. What about inspiration? A diagram is given in your textbook, that is this one. Inspiration. Now what is inspiration? If the pressure within the lungs is less than the atmospheric pressure, there is negative pressure in the lungs with respect to the atmospheric pressure. Now what are the mechanism of inspiration? The contraction of diaphragm increase the volume of thoracic chamber. When the diaphragm contract, the volume of thoracic cavity will be increased. The contraction of external intercostal muscles lift up the ribs and sternum, causing the increase in the volume of thoracic chamber. Okay, and this is in dorsoventral axis. It causes an increase in pulmonary volume and decrease the intrapulmonary pressure to less than the atmospheric pressure. It forces the air outside to move into the lungs. That is inspiration. Okay. Now second part, expiration. This is diagram given in your textbooks. It is expiration process. Relaxation of diaphragm and sternum to their normal position and reduce the thoracic and pulmonary volume. In this, it increases the intrapulmonary pressure slightly above the atmospheric pressure. It causes the expulsion of air from the lungs into atmosphere. Okay, that is expiration. Now what about the respiratory tract? Respiratory tract in human, that is a pair of external nostrils, then nasal chamber or nasal passage, nasal chamber, nasal passage, nasopharynx, then glottis, also a diagram given in your textbook, that is glottis, then this is epiglottis. Okay, this is larynx, then trachea, then left and right bronchi, secondary and tertiary bronchi. These are secondary and tertiary bronchi, and bronchioles, subdivisions of bronchi, that is bronchioles. After that in alveoli or air sac. Each lungs covered with double layered membrane known as pleura, or with pleural fluid between them. Okay. Now some respiratory organs in animals. Number one, body surface. Example, protozoans, annelids, frogs, etc. Number 2, gills. fishes, tadpole stage of frog, and many other aquatic animals. Number 3, tracheal tubes. Tracheal tubes. For example, insects and a few other arthropods. Number 4, lungs. Example, all land vertebrates, amphibians, reptiles, aves, and mammals. Okay. Now, what are the conditions required for the cutaneous respiration? Skin, number 1, skin should be moist and thin, and number 2, should be highly vascularized. Okay.